Good morning, everybody. My name is Spyros Pournaras. I am clinical microbiologist in a Greek university hospital. I want to invite you all to the ECCMID 2023, which this year will be held in Copenhagen. In this short talk, we will discuss about the changes in the healthcare-associated infections during the COVID-19 pandemic. During the pandemic, most of the healthcare institutions were experienced tremendous pressure due to the massive hospitalization of COVID patients, which were even more particular in the ICUs, most of which triplicated their beds. The capacity was almost 100%. This pressure affected considerably the antimicrobial stewardship efforts and also the infection control practices and caused burnout in the majority of healthcare workers. This pressure also resulted to increase in the antimicrobial resistance and also the antimicrobial resistant infections. There were, during these two and a half years of the pandemic, there were plenty of reports of increased infections due to resistant bacteria. Most of the reports referred to carbapenem-resistant Enterobacteriaceae and Acinetobacter baumannii, and also drug-resistant Candida auris, while many limited reports dealt with reduced infections mainly due to MRSA and VRE. In a nationwide report from the United States, there were a considerable increase in the standardized infection ratios in most of the nosocomial infections, particularly eclampsies, cotis, and ventilator-associated events. In Greece, in my country, we also faced tremendous increases of the infections, which were more pronounced in the case of bacteremias, bloodstream infections. I will give you some data from my hospital, at Iconic University Hospital, which is representative of the majority of Greek hospitals. And for my hospital, we have detailed data until the end of August 2022. So in my hospital, the carbapenem-resistant Enterobacteriaceae increased very, very much. The incidence density rate was increased almost 3 times for Enterobacteriaceae and more than 3 times for Acinetobacter baumannii. These infections were very, very significant statistically, while also the Clostridioides difficile infections also increased almost 1.5 times the incidence density rate, which was also significant. In contrast with these infections, the infections due to MRSA were much fewer, while the VRE infections remained unchanged. During the same period, the 2.5 years of the COVID pandemic, we faced a considerable increase in the antimicrobial resistance. In the case of Enterobacteriaceae, we observed the increase in the resistance rates for colistin aminoglycosides and cotrimoxazole, for Acinetobacter baumannii. And for Enterobacteriaceae, we observed a significant increase in the resistance to colistin, aminoglycosides, tigecycline, fosfomycin, and the third-generation cephalosporins. Now that we have counted down these increased rates of infections and resistance, it is time now that the COVID pandemic goes to the end, it is time to restore and even enhance our efforts for antimicrobial stewardship and infection control in order to come back to the numbers before the pandemic and a bit relax as much as possible the situation. Thank you for your attention.